Hello class, my name is Jake Stevens, and today we're going to learn about shoulder injuries, the different components of the shoulder joint, and the injuries that can occur specifically when dealing with athletes. Some of the objectives that we want to cover today are, like I said, the different components of the shoulder, so the joints, the bones, the muscles, and as well as the different types of injuries that can occur, and some of the causes, symptoms, and possible treatments for those. To start us off, I'm going to show some videos of some athletes being injured.
Yes, he did. And he ran right past us. Right to the locker room. Right shoulder popped out. So a big moment here. As Kevin Love's shoulder popped down.
So this first one, we have a basketball player here who's suffering a dislocated shoulder. It was just from another player pulling on his arm. So we'll show the highlight in just a second. You can see any type of, let's say, a kind of common play, two players battling for an injury, waiting for a basketball injury like that can occur. So you just tug on his shoulder. You can kind of see, I don't know if you can see with this angle, but there's a little indentation there. That's where you can kind of see where the shoulder popped out.
Pulling on the arm, connected with the arm.
See our next one.
Kevin Love, and as he's trying to get his arm.
Here we have a
Second Vikings, Brett Favre and Leslie Frazier won last weekend, making his head coaching debut.
who is driven into the ground, and he actually suffered an AC joint injury here.
As he was hit, Brandon Florence makes the
He
interception
separated
at the
his shoulder on
45,
this play,
but
and
Brett
it's just a mild
Favre was hurt
separation
on the play. He got
full
drilled
separation.
in the
You
back.
see he's driven into the ground right there.
Arthur
Let's
Moss
throw his
nailed,
shoulder.
so he left the game with a shoulder injury. Heading to the locker room, Tavares
Called
Jackson
separation from his shoulder. And then finally,
It would sit, oh, look out.
we have a baseball play here. Very common play, you'll see a lot in baseball. Just diving back into a bag like that.
Picks up Brett.
But like I say, nothing weird or strange or anything about that play. It's just his arm. You'll see replay in a second. His arm kind of gets caught on the ground. It's his left shoulder that he injures. And it's actually a subluxation, I believe, which is real similar to a dislocation, but the shoulder doesn't stay out.
With an injury.
They'll show it in
Let's
just a
check in
second.
with Todd for an update on Ryan Brett.
So you can see nothing,
back into the bag, his
no
trail
strings
arm,
there,
his
body,
left arm, there was a
anything like that,
subluxation
but
of his
the
left
injury
shoulder,
dive being right
basically
there,
the left shoulder
left
popped
arm, you can
out
see
and had
it
to be
kind
popped
of going
back
in
in.
there.
You can see
That's
it like with
where
the left hand, a
injury
subluxation
occurred.
of the left shoulder. That's what caused Ryan Brett to have to leave the game, guys.
Okay, so just kind of the basics of the shoulder here. These are some of the main components of the bone of the shoulder. You have your clavicle, which is also known as your collarbone. Right there, it's just kind of a common name for it. You have the cord process and the chromium process, which are both attached, or both actually parts of the scapula, which is also known as your shoulder blade, a little more common term. Same thing with the glenoid cavity. It's actually just a part of your scapula, but the glenoid cavity is where the head of the humerus, which is your upper arm bone, where it fits in. So when a shoulder dislocation happens, that's what's actually happening, is the head of the humerus is leaving the glenoid cavity, which we'll cover that in just a second. Some of the muscles, the four main most common ones that you'll hear about make up the rotator cuff. And those are the subscapularis, the infraspinatus, the supraspinatus, and the teres minor. They all serve the purpose of helping rotate the shoulder, move the shoulder. Like, let's see, the internal rotation, external rotation are the main functions of the subscapularis and infraspinatus. And then ligaments of the shoulder, there's several of them in there, running all different directions. But some of the main ones we want to cover here are the acromioclavicular ligaments, which is part of the AC joint. So whenever you're dealing with the shoulder separation, that's what you're going to be dealing with. And then the coracoacromial ligament, coracohumeral ligament, glenohumeral ligaments, and transverse humeral ligaments as well. All right, now types of injuries. First one we're dealing with here is shoulder dislocation, which we saw with the basketball player, Kevin Love, earlier. This can be caused by any kind of blunt force trauma to the shoulder, or like I said, a tugging on the shoulder, or pulling on the shoulder, anything like that, any kind of sudden movement like that. There's three different types. There's posterior dislocation, which is where the head of the humerus goes out the back of the glenoid back of the shoulder joint. Anterior dislocation is where it comes out the front side, and then inferior dislocation, in which it goes out the bottom. Some of the symptoms, like I said earlier, there's a visible deformity, so there's like an indentation right there. You can kind of see, especially if it's staying out. There'll be a little hole, a little indentation there that you can see in the shoulder. There'll be swelling and bruising, intense pain, and a lot of times the athlete won't be able to move their shoulder. Some of the treatments, closed reduction, usually you want a professional doing that. That's just placing the head of the humerus back in the shoulder joint, like popping the shoulder back in. Surgery, sometimes it will require surgery because there'll be ligament damage. It's often accompanied by some other injuries to the shoulder, ligament damage usually. Mobilization, so a lot of times you'll want to put it in a sling, keep it immobilized for several weeks. It would be usually about 6 weeks. And then you'll start doing some strength and range of motion exercises to help regain that strength. Next one is a separated shoulder, which is what we saw that the football player suffered. Like I said, that's usually an injury to the AC joint, like the acromiopurbicular ligament there, which attaches the acromion to the collarbone. There's 3 different grades. There's grade 1, grade 2, and grade 3. Grade 1 is the least severe. It's just a slight tear in that ligament there. Usually doesn't require surgery or anything like that. Grade 2 is just a partial tear, so that tears a little bit more, but it's still not completely tore. And then grade 3, there's a complete tear of the ligament there. And so the symptoms of it, there's obviously going to be pain, swelling and bruising, and then there's shoulder or arm weakness, limited movement, and then oftentimes you'll see a bump right there on the shoulder, kind of where the collarbone meets the head of the humerus there. So that's some of the visible symptoms of it. Treatments, it's really just rest and ice are kind of the main two, especially if it's not as severe. Stretching and strengthening exercises, getting the movement back in the shoulder, getting it stronger, and then also surgery if it's a severe enough case, as in a grade 3. And we have rotator cuff injury. A lot of times, I say this is accompanied with a dislocation or some other kind of injury like that. It can also be as a result of lots of overhead throwing motions, things like that. You'll hear a lot of times baseball players, quarterbacks, things like that, they suffer these injuries just because of the wear and tear over the years. So that's just a tear in one of the rotator cuff muscles. Typically it's the supraspinatus tendon there, which is the one on top. Some of the symptoms of it are pain, again, reduced range of motion, a dull ache. The athlete will feel a dull ache in the shoulder, and then again, shoulder or arm weakness. So if they're a pitcher or something like that, they won't be able to throw as hard. You'll notice a decrease in velocity, things like that. Treatments, a lot of times if it's just a minor tear, you can treat it with steroid injections. That'll help reduce pain, reduce swelling, reduce inflammation, things like that. And flexibility and strength exercises, you want to strengthen those other muscles to kind of make up for the one that's torn. And then surgery if it's a severe enough case, if the symptoms don't improve. Next we have a labral tear. The labrum is like the cartilage type material that holds the head of the humerus in the glenoid cavity. So a lot of times whenever you have a shoulder dislocation, you often see this accompany it, tear of the labrum, because whenever the head of the humerus leaves the shoulder joint there, it'll, like I say, tear the labrum there. Some of the symptoms of it, you can hear like a popping or a clicking in the shoulder whenever you're moving it. So if you're moving it around, you might feel that clicking, you might even hear like a popping noise. Pain in overhead movements, like I say, so a lot of the overhead movements, you're coming up here, that joint's really grinding around in there, hitting on the tear. Weakness and instability in the shoulder, and then aching pain. So again, you'll see a lot of movement kind of in that shoulder joint. It won't be very stable. Treatments, typically you want to treat it with some type of physical therapy first. Again, like shoulder stability exercises, you want to strengthen that rotator cuff, hopefully help kind of hold that joint in place a little bit better, or that head of the humerus in place a little bit better. Steroid injections, again, just to treat inflammation, pain, things like that. And then severe enough cases will require surgery. And then our last one is called a frozen shoulder, also known as adhesive capsulitis of the shoulder. And this typically comes like after you've had other injuries, your shoulder's been immobilized for a while, it'll kind of stiffen up. So like I say, one of the symptoms is pain and stiffness, gradually increases over time, and chances increase with other injuries that limit motion. So if you just had surgery, or been immobilized for a little while, that's something that can typically come along. Treatments, range of motion exercises, corticosteroid shots, again, like I say, pain and inflammation helps with that. And then sometimes you might have to require surgery to help loosen it up in there. And then, although they sound pretty bad, like I say, a lot of times these players can return to play. So this first one here is just Brett Favre
Out of the shotgun, Chester to his right. Third down, 12 seconds to go in the game. Niners lead by 4. Barr back to pass, pumps to the left. 8 seconds left. He gets away from the pressure. Fires to the end zone. It's shot! It's Mike Lewis!
no limit to play, no limit. And then again we have the basketball players. Dislocated shoulder, so they want to pull back. No limits to his ability. He can get in there and they do all the things that he was able to do before: rebound, shoot, pass, rough it up and dish it. And that's